Shingles is the reactivation of the chickenpox virus. It can be quite painful, and even after it resolves, because of the robust inflammation of the nerve, you can have a period of pain that we call postherpetic neuralgia after having an episode of shingles. The most concerning complication of shingles is postherpetic neuralgia. That can be a really deep, burning, uncomfortable, crippling pain, depending on the location, that can require oral medications that affect the nerves. I have patients that can have this pain for years and years and years, that can disturb their sleep, disturb their daily activities. The risk of having postherpetic neuralgia, or this long-standing pain after having a shingles outbreak, increases with age. So older patients are more at risk for having that crippling, long-standing pain. If you do not have the pain or the postherpetic neuralgia, you can still have other side effects post-shingles. Because you're having this robust vesicular eruption, you can have scarring, you can have hyperpigmentation, and depending on where you had the shingles, if it's in a sensitive cosmetic area, it can be really upsetting for patients. Depending on the dermatome or the pattern that you have your shingles, it can be an emergency. Shingles in the dermatome that includes the upper forehead, the eye, and sometimes even the nose, this is what we call an ophthalmologic emergency. That inflammation can really compromise the vision. So if you're noticing that you have shingles and it involves that dermatome, make sure that you see an ophthalmologist quickly so that your eye can have the appropriate monitoring and you can have the appropriate treatment. What we do know is that if you treat your shingles outbreak early, you're at a lower risk of having the most negative sequelae of shingles, which is postherpetic neuralgia. So what's critical is that if you know that you're prone to shingles, the minute you see that vesicle, see your primary care doctor, see your dermatologist, so you can have treatment, so you can reduce your risk of having long-term pain.